so a counter view to that, and I'm sure Dilshan would agree to that, is when you enable all of technology with current, credible evidence at the, at the word go. So all of technology needs to make sure that all of medical knowledge goes along with it. And this is not a trial and error thing. It needs to be tested before it gets on to patients, because I think patient safety is cardinal. Wouldn't you agree, Dilshan?
Okay, so the thing is, if you look at healthcare, we preach that healthcare is a human profession, right? It's human from the sense of a patient, it's human from the sense of a family member of the patient, it's human from the nurse and the doctors and whoever it is that's in the healthcare domain. Now, between machine and man, there are always boundaries. And I think it's very important for us to understand that automating a process or a procedure completely without a human interface is going to be impossible. And we've had this debates over the last few years on HMA as well, where two parties would speak about robots replacing doctors. I stand with the fact that I think a lot of us would agree that the robots would have limitations in terms of how we engage with our patients, because sometimes being human is essential for us to be safe with our patients.
Absolutely, I agree. And in fact, the whole concept of brain-computer interfaces, it's essentially removing all of the watershed there is between machines and humans. So you now have people actually moving machine parts with EEG patterns, and that's a reality. So essentially what we are trying to say is make sure that all of human intelligence is encoded into all of digital as we go along.
Expanding on what you said about moving machine parts with EEG patterns, can you imagine if an epileptic is operating the machine?